Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about ovarian cancer. Sex cord stromal ovarian cancer. Ovarian refers to the ovary of which women have two that sits along either side of the uterus. The term sex quarter is the embryonic structures that develop into ovarian follicles. And stromal cells are the connective tissue of any organ. So, a sex cord stromal ovarian cancer is a type of tumor that develops from either ovarian follicles, cells, or connective tissue cells. Each ovary has multiple follicles. Each follicle is made up of an oocyte, which is an immature egg surrounded by two types of cells. Teeka cells and the granulosa cells. Granulosa and the Teeka cells work together to support the follicle development. Luteinizing hormones stimulates the Teeka cells and generate androgen and follicle-stimulating hormones to stimulate the granulosa cells to convert those androgens to estradiol. Using the enzyme aromatase, a large increase in estradiol triggers ovulation. During ovulations, the oocyte pops out to the ovary, causing a bit of a damage to the surface. Fibrocytes detect the damage and differentiate into the fibroblast and lay down collagen to help repair to damage. If any of those cells start to divide uncontrollably, it can either form a benign tumor, which means that it doesn't invade nearby tissues or spread to other parts of the body. Or it can be either malignant tumor, which means that it can invade nearby tissues and spread to other parts of the body. Compared with the benign tumor cells, malignant tumor cells have key features, like not having a clearly defined border or like having slightly less organized nuclei. The first main type of sex cord stromal tumor is a granulosa Teeka cell tumor. And these are the most common malignant stromal tumors are associated with the middle-aged women. These tumors often end up producing way too much estradiol, and this can cause very specific hormones associated with symptoms like uterine bleeding, breast tenderness, and early puberty in the young girls. Under the microscope, these tumors classically develop little fluids, packets scattered throughout the tissue that are called exner bodies. The second type of tumor, fibromas, are made of fibroblasts and are benign tumors. Under the microscope, they look like thin needle-like strands with elongated nuclei that are bundled together. Benign fibromas are often seen in combinations with ascites, a fluid buildup in the peritoneal cavity, as well as the pleural effusions of fluid buildup in the pleural cavity. In fact, the clinical triad of a benign ovarian tumor with ascites in a pleural effusion is better known as the MEG syndrome. The exact pathogenesis here, though, is unclear, but it's thought that the solid ovarian tumor irritates the peritoneal and pleural surfaces, which leads to the transudative fluid buildup in both spaces. Fibromas can occasionally grow to the size of an orange and can cause pulling sensations in the groin when it compresses the round ligament of the uterus. The third type of tumors are called Sertoli-Leydig cells tumor because they look like Sertoli-Leydig cells normally found in men. It turns out that the tumors are actually made of primitive gonadal stroma, which is so undifferentiated that the cells can secrete androgens like testosterone. Increased levels of testosterone can cause women to have more masculine features, like hirsutism, which is increase in hair growth. Under microscopic, classically, there'll be Ranke crystals, which are pink, rod-like crystals in the cytoplasms of the cells, and these are the kind of the light, bright pink magical crystals you'd collect in a video game. So during the ovulation, the follicle ruptures and releases an egg, which inadvertently leads to epithelial cells damage. To fix that damage, the epithelial cells have to undergo the cell division. To replace and heal that tissue each time the cells divide, there is a chance of mutations and the possibility of a tumor formation. So things that are associated with a decreased risk of ovarian cancer include things that reduce the number of ovulatory cycles, like pregnancy, breastfeeding, and oral contraceptive use. On the flip side, some things that are associated with an increased risk include certain medical conditions like endometriosis and polycystic ovarian syndrome. There are also some genetic risk factors like having the BRCA1 or BRCA2 mutations, which are both autosomal dominant mutations, which in addition to ovarian cancer, carry with them the increased risk of the breast cancer. There are also hereditary non-polyposis colorectal cancer, also known as the Lynch syndrome, which increases the risk of developing a number of cancers, increasing the ovarian cancer. Generally speaking, symptoms of ovarian cancers can be subtle and non-specific. Common early symptoms can include abdominal distension, bloating, as well as abdominal or pelvic pain, which can come from the ovarian torsion where the ovary gets twisted. Occasionally, ovarian tumors can cause ascites, abdominal masses, bowel obstructions, or dyspareunia, which is pain during sexual intercourse. A classic finding is a Sister Mary Joseph nodules, which happens when a cancer metastasizes to the umbilicus. This finding is often linked with few types of cancers, one of which is the ovarian cancer. Diagnosis of ovarian cancer typically involves looking for specific tumor markers like the BCHG, as well as having a transvaginal ultrasound. Tumor biopsies are done to figure out whether a growth is benign or malignant. An imaging with a CT or MRI scan can be done to look for the evidence of metastasis. Treatment of ovarian cancer typically involves chemotherapy, surgery, and sometimes radiotherapy. Surgery may not be enough for malignant tumors confined to the ovaries, whereas the chemotherapy might be needed for the disease that spread. Carbohydrates antigen 125 called CA125 is protein produced by various types of ovarian tumors. So tracking the levels of these biomarkers in the blood can help monitor the response that there be a potential relapse. Alright, as a quick recap, sex stromal ovarian cancers originate from the connective tissues in the ovaries. Granulosa Teeka cells tumors secrete excess estradiol, as well as to develop called exabodies. Fibromas can become large and are associated with Meg syndrome, and Sertoli Leydig cell tumors can secrete excess testosterone and develop ranking crystals. Increased risk for developing ovarian cancers are associated with increased cumulative amount of time a woman spends in ovulation, and therefore decreased risk is associated with pregnancy, breastfeeding, and oral contraceptives.